today my topic is going to be on something that many of you may not have heard before. It is called Sjogren's syndrome. So what is Sjogren's syndrome? Sjogren's syndrome is a lifelong chronic autoimmune disorder that causes insufficient moisture production in certain glands of the body, including the saliva-producing and tear-producing glands. So an autoimmune disorder that means something triggers your immune system to attack healthy cells. This attack damages the tear system in your eyes and the salivary glands in your mouth. There are two types of Sjogren's syndrome. There's a primary that develops on its own, and there's a secondary that develops in addition to other autoimmune disease. So let's talk about what causes Sjogren's syndrome. Exactly what causes this abnormal immune system response is not clear. These factors may, however, play a role. Environmental factors, genetics, sex, hormones. The condition affects more women than men, as well as viral infections. So what are some of the symptoms of Sjogren's syndrome? In addition to extremely dry eyes and mouth, some people experience muscle pain and joint pain all over the body, similar to fibromyalgia. Other symptoms include abnormal sense of taste, burning or redness in the eyes, feeling like a sand, blurry vision, difficulty chewing, swallowing, or talking, a dry cough or hoarseness, dry itchy skin, enlarged salivary glands, fatigue, muscle or joint pains, tooth decay or early tooth loss, and vaginal dryness. Other possible symptoms are the dry itchy skin, the severe tiredness, exhaustion, as we spoke about vaginal dryness, which can make intimacy painful, rashes, especially being in the sun, a dry cough that does not go away without treatment, swelling between the jaw and ears, swollen salivary glands, muscle pain, joint pain, stiffness and swelling, difficulty with concentrating, remembering, and reasoning. Some people with Sjogren's syndrome also have other closely linked conditions, such as rheumatoid phenomena, a condition that affects blood supply to your fingers and toes. Raynaud's phenomenon, my apologies. So who gets Sjogren's? Sjogren's syndrome typically occurs in people with one or more known risk factors, including age. It's usually diagnosed in people older than 40. Women are more likely to have it versus men. Rheumatic disease. It's common for people with Sjogren's to also have rheumatic disease such as rheumatoid arthritis and lupus. So how is it diagnosed? If you have dry mouth, dry eyes, or other signs, your doctor may use methods such as a blood test, biopsy, eye exam, imaging tests, and health history. How is it treated? There's no cure for this syndrome, but treatments can relieve the symptoms depending on your specific issues. Your doctor may recommend one or more of these therapies: artificial tears, prescription eye drops, punctual plugs, surgery, autologous serum drops. Treatment for dry mouth, salivary producers, prescription medications, dental care, which is key. A dry mouth increases the risk of dental cavities, infections, and tooth decay. Your doctor may recommend a prescription toothpaste and mouthwash, as well as regular fluoride treatment. Treatment for the joints and organ problems, over-the-counter pain medications, anti-rheumatics, immunosuppressants, steroids, as well as antifungals. Treatments for vaginal dryness. If the vagina is also dry, itchy, or sore, you should check your healthcare provider to make sure that issue is not something more than hormonal changes. Trying vaginal moisturizers or lubricants to add moisture to the vaginal area daily, using unscented soaps for cleansing, and asking your healthcare provider for vaginal estrogen therapy as well. Vitamins that are good for patients with Sjogren's: betaine, HCl, borage oil, magnesium glycinate, artemisinin, DHEA, probiotics, megaspore, vitamin C, probiomed, quercetin plus C, vitamin D with K2, foresight, which is good for the eyes, ultra-nutrient multivitamin, ultra omega, and ProBoost. So what are some of the complications of this syndrome? Most people who have Sjogren syndrome live their lives without any significant problems. However, a dry mouth means that you are more likely to have dental problems, such as tooth decay and infection. Dry eyes can also place you at risk for eye infections. If you have secondary Sjogren syndrome, you may also have problems like joint pain caused by rheumatoid arthritis or lupus. Rarely people with Sjogren syndrome develop these complications, but it's possible. Abnormal liver or kidney function, lymphomas, lung problems that may be mistaken for pneumonia, neurological problems that cause weakness or numbness, skin rashes. There's also a slightly increased risk of a type of cancer called non-Hodgkin's lymphoma. So what should someone eat when they have this syndrome, or what should they not eat? An estimated 90% of people with Sjogren syndrome have problems related to eating. In some cases, these problems can be enough to cause malnutrition. Troubles can be related to dryness or swelling of the throat, as well as intestinal tract or nerve damage. There also seems to be a significant number of people who have both Sjogren's and celiac disease and/or symptoms of irritable bowel syndrome. If you have gastrointestinal symptoms, you can work with a registered dietitian to find out what food sensitivities you may have. Problems with gastrointestinal reflux are also common among people, and among these people with this syndrome in particular. Your care team can provide you with tips for dealing with GERD. These might include not eating 2 to 3 hours before you lie down to sleep and avoiding greasy food. There are some recommendations that people who have autoimmune disorders like Sjogren's should follow an anti-inflammatory diet to help with joint pain and other symptoms. Some people have found relief from a completely plant-based diet. Here are some tips that might help you manage other types of eating issues. Eat smaller amounts of food at one time, but eat more frequently throughout the day. Include soft foods in your diet. Be sure to chew your food completely. Avoid cavities by reducing the amount of sugar you eat and drinking only water before you go to bed. Avoid what's called nightshades. These are a family of plants that includes tomatoes, eggplant, white potatoes, peppers, curry, eggplant, I just said eggplant before, sorrel, okra, cayenne pepper, and paprika, and goji berries. Avoid raw vegetables as well. So these are a picture of what a nightshades look like, these vegetables, but they're substitutes that you can have. So instead of having the white potato, you want to have sweet potato. You can have cauliflower. Instead of having the eggplant, you can have mushrooms. You can have celery. You can have beets, as well as carrots. So what kind of doctor treats this syndrome? Many types of doctors may be involved in the person's care. These include a primary care physician, a dentist, especially such as a rheumatologist, an ophthalmologist, an otolaryngologist, also called an ear, nose, and throat doctor, so your ENT doctors. I want to give special acknowledgement to the Cleveland Clinic, NHS, HealthQuestVitamins.com, and the Mayo Clinic for the information that I provided to you today. I hope this was helpful. I hope you learned something. Please feel free to join me in the Zoom room immediately after service. I'll be happy to answer any questions for you. Thank you. God bless, and have a wonderful day.